welcome to our webinar on COVID-19 and its global impact on exotic animal veterinary practice. Just to introduce myself, my name is Dean Felkler and I'm the founder and CEO of Exotic Vet Support, an exotic animal teaching platform for vets that will be launched over the next few weeks. I used to work in the UK and I did so for 7 years, but I'm now currently working in Hong Kong with 100% exotics in private practice. I'm also joined here by Dan Calvo, who I'm sure a lot of you already know, and he's a European veterinary specialist in avian medicine and surgery based in the UK. Although there have been a number of COVID-19 webinars out there already, we just wanted to share some of our latest findings in exotic species, summarise some main points, and provide my perspective of living and working in Hong Kong, being so close to where it all kicked off. Just to let you know, there is some hope on the horizon. New cases have really started to slow down over here, and current statistics show Hong Kong have only seen 3 new cases in the last 10 days. So there is some promise that this will start to hopefully slow in other countries throughout the rest of the world too. So Dan is going to start us off with a nice overview of coronaviruses.
So thank you very much, Dean, for the introduction. I just wanted to start touching bases with coronaviruses in general. I do not want to bore you necessarily with details, but I think it's important that as a professionals we understand a few things. So coronaviruses are RNA viruses, and their name comes from the Latin corona, which means crown. That's due to the spike protein, which are protruding from the membrane, and is their main antigen, and is also what allows them to invade host cells. So coronaviruses are rather common, and as with many other family of viruses, we probably just know of a few, but there is probably at least one, if not more, coronavirus for each animal species out there. So obviously we focus when we talk about that, we know in our field that what may cause clinical disease. So coronaviruses, coronavirus mutation rates are not greater than other viral families. However, being RNA viruses, they're obviously more susceptible to mutation than DNA viruses. Their RNA is slightly longer than in other viruses, and that obviously increases the likelihood of copy incident compared to viruses with a shorter genetic material. Something is also worth remembering is the recombination ability is also an important feature of coronaviruses, and that's something that has been studied quite well through the SARS outbreak in 2002. So this, coupled with mutation, allows adaptation to occur in a relatively short period of time compared to other viruses, and that's probably what's happened in the current situation. Coronaviruses are divided in 4 groups. That is alpha, beta, gamma, and delta coronaviruses. So alpha coronaviruses are most commonly found in bats, but it also contains a few viruses that are well known to us, such as feline coronavirus, which feline coronaviruses cause the enteritis, but obviously in vivo mutation then can cause the feline infectious peritonitis, as you probably all know. There's obviously also the canine coronavirus, as well as the human coronavirus 229E, which is part of a cold complex, the common cold in humans. It also includes ferret coronaviruses, which sadly I do know a little bit more about them. I identified one of the first described cases here in the UK a few years ago. So funny enough, compared to the feline coronavirus, they're very similar, but they're meant to be 2 different viruses. So it's not an in vivo mutation as in cats, but rather 2 different viruses. One that is the ferret enteric coronavirus, which called the episodic cathedral enteritis, and the other one, which is the ferret systemic coronavirus associated disease that causes a clinical disease similar to FIP. We also have 3 different porcine coronaviruses. The transmissible gastroenteritis coronavirus, which then seemed to eventually mutated and evolve into the porcine respiratory coronavirus. And then we also have the porcine and epidemic diarrhea virus, also affecting pigs. So in regard to Beta coronaviruses, those are seen mostly in mammals, from ruminants to carnivore species, including hedgehogs and bats, and obviously includes the three recent emerging coronavirus: the SARS, the MERS, and obviously the new boy in the block, the SARS-CoV-2, which is a causal agent of COVID-19. That's the clinical disease seen in humans. Another virus included is the human coronavirus OC43. It's also part of the flu complex. By the way, if you wonder, the majority of the flu viruses are rhinoviruses. If you're thinking about it, there's also within the Vita coronavirus, there's also a pig or a porcine coronavirus, the porcine and agglutinin encephalomyelitis virus. So in regards to gamma coronavirus, that includes some viruses from cetaceans and also a few from birds, including the infectious bronchitis virus, the turkey coronavirus, which is part of the poult enteric complex, and a few more other viruses like, for example, the ostrich coronavirus, which is part of the ostrich chick fading syndrome. In regards to Delta coronaviruses, they're also, again, mostly avian viruses, with some recent porcine virus, Delta coronavirus, which do seem to be causing also gastrointestinal disease. And there's also a recent one isolated from leopard cats. So overall, we know that bats are well known to host many of those viruses, including various coronaviruses at the same time. Those may not cause clinical disease, and these include also some very specific coronaviruses that are specific to one species or only one genus of bats. It is also worth noticing that after the first year of life, more than 80% of domestic species, including dogs, cats, cattle, or pigs, are seropositive for at least one coronavirus without expressing clinical signs. So I think those things are important to remember if we're going to be looking into doing any testing at all, or we're going to consider any testing in any of the animals we may see in practice. And I think there's been a lot of discussion in the media, and we need to understand what the testing means before we expose ourselves or we do it, because we will have to inform clients, and we need to be able to communicate with them what it means. So generally, coronaviruses are species adapted, and transmission from one species to another is rather rare. There's only a few described species of coronaviruses that have shown a broad host species range that obviously can include humans, and those are the ones that we know. The SARS-CoV-1, which obviously we think it comes from civets. It can affect humans, raccoon dogs, horseshoe bat, and others. The MERS, which obviously will include again bats, humans, as well as camels. And the bovine coronavirus, which can affect a number of ruminants, including also camelids, dogs, and occasionally humans, but that will be uncommon.
There is a lot of speculation out there about the origins of COVID-19, the Wuhan wet market being a highly suspicious location, and workers on this market were reported to be some of the first to be infected. It does, however, become a little bit more of a grey area when we try and localise how the virus originally transmitted to humans. As lots of us are aware, human consumption of bats have been implicated as the cause here. So naturally, we would put this information together with our previous experience of wet markets, probably being responsible for the highly pathogenic H5N1 avian influenza and the SARS-CoV of 2002. There is a lot of literature out there on this, and I have two example publications here. One from the Journal of Advanced Research and the other one from New Microbes and New Infections. These support the genetic makeup of SARS-CoV-2 is very similar to SARS-like bat virus and the implications of the Wuhan wet market. I just wanted to clarify what a wet market actually is for those of you that don't know. This is simply a market that sells fresh fish, meat and or produce. These are not necessarily live food items where the animals are slaughtered on purchase. In fact, there's a lot of wet markets across Hong Kong, but there are very precise slaughterhouse regulations that must be followed. Live poultry is still permitted, but only in specifically allocated sites, and again, regulations are controlled. No wet markets in Hong Kong include exotic or wild animals. I decided to take a day trip out today just to take some photos, just so I can show you all what a typical wet market in Hong Kong looks like. This one here sells meat, fish and produce, and to be honest, it was very, very clean. Everything looked nice and fresh. Now, whenever I used to think about wet markets, I always used to think of poor sanitary conditions and maybe poor animal welfare as well, but this is just not the case. Obviously, it just depends where you go, and much like other industries such as farming and slaughterhouses, they all have different standards. Now, Hong Kong wet markets are governed by Hong Kong, and different standards may be present in other countries such as China and the rest of Southeast Asia, and I'm sure you've all seen images online or on TV of other wet markets. Now, bats not the only animal suspects on the list, and in fact, wet markets are not 100% sure to be the culprits here either. Unfortunately, there's a lot of wildlife trading that goes on in Southeast Asia. These are mainly for consumption and medicinal purposes. Now, it's fairly common knowledge that rhino horn, tiger bones, bear bile have been used for traditional Chinese medicine throughout this region. However, pangolin scales have also been used for medicinal purposes and then meat for consumption. It just so happens that pangolin coronavirus also show a very similar phylogenetic relationship with SARS-CoV-2 and bat-CoV. In fact, SARS-CoV-2 share 5 receptor binding domains with pangolin coronavirus, whereas it only shares 1 with the bat coronavirus. We have a publication here from Current Biology that shows this. Non-human primates are also part of wildlife trading in this region, and naturally these would be a source of concern as well. Studies in macaques have shown they can act as non-expressive hosts, but also animals that can display clinical signs of COVID-19. This publication from Science shows this and displays its usefulness in understanding key pathways to help provide preventative and therapeutic strategies for SARS-CoV-2. Now, these are only a few studies, or a few species that have been studied. There may be so many more hosts that have been undetected, so a lot more work needs to be carried out to provide us with a more comprehensive understanding of the disease and animals that can act as hosts and reservoirs.
So I just wanted to add a little bit to the discussion that Dean has started. So from those two papers that you could see here, we could see that we know that SARS-CoV-2 shows 96.3% of genomic identity to the bat coronavirus RATG13 that was previously described in whole show bats from southwest China. However, I think there is a difference with the receptor binding domain, what they call the RBD, of the spike protein between the two viruses. The SARS-CoV RBD is adapted to receptors ACE2, which allows it to enter human cells, while the bat COVID RATG13 is not, therefore is not able to affect humans. Pangolin coronaviruses have been described from Malayan pangolins, confiscated in 2019 and 2018, I believe. In regards to the RBD region, there seems to be more similar to the SARS-CoV-2 than to the bat one. They all share 5 key amino acids that, in invading human cells with SARS-CoV, whereas the bat one genome only shares 1 out of 5, as Dean has already said. However, it's important to note that the pangolin or any other species have not been confirmed to an intermediate or amplification host in the SARS-CoV-2 outbreak. On the whole genome basis, it seems that the coronaviruses from pangolins are very different from the SARS-CoV-2. Also, something that is being discussed is worth mentioning and understanding is that horses show bats were hibernating when that outbreak started in China, and there is a general consensus that the viruses didn't come directly from them, but it is originated from that bad COVID RATG13. Which probably required an intermediate or amplification host, which then also caused the changes on the RBD, which allowed it to infect human cells. So obviously at this stage, it's all speculation and we don't truly understand it completely, and we don't fully understand this, but that's what the current theory is.
Now, there could be other possibilities for the origin of this coronavirus. One such being a lab could have been unsuccessful with its biosecurity, and I'm sure some of you would have heard that over the last sort of week or so. It has hit the news. Now, this won't be the first leak in history, and in fact, they do happen too frequently, but obviously not to this scale. This could have been work on a coronavirus vaccine, or even research into a combination of bat and pangolin viruses. So we have discussed the relationship of wet markets, bats, wildlife trading and imports, and China has actually moved into action and introduced a ban on non-aquatic wildlife for food consumption. This was implemented on the 24th of February 2020. Unfortunately, this is not yet the case for medicinal use, so there will be a reduction, but loopholes in the law will be found until a complete ban has been put into action. Once again, this is only a small number of species that have been examined, so more research needs to be done in this area.
So obviously in regards to susceptible species, there's a number of species that can be affected. That includes felids, mustelids, primates, and canids. But I think there is, and I think if you get one single message from this talk, I hope it's that one. The main species you really need to watch for is that one. And when I said that one, I mean to this one, Homo sapiens. We need to put things in perspective, and the current pandemic is the result of human-to-human transmission. Everything else that has been seen are just spillovers of this pandemic. You know, the fact that humans can transmit and some animals may or may not replicate the virus, may or may not develop clinical signs, and may or may not be able to shed in significant numbers, is actually probably just marginal and not really significant. I think having said that, we do need to have a good understanding, because we will see all those animals in practice and clients will ask, and we need to be informed and be able to understand this completely and pass the right information. So having said that, I think most vets are very familiar with adequate biosecurity and hygiene standards. Those working in exotic practice, you see a variety of species, and I'm sure that you're used to wash your hands regularly between patients and to use other measures. You know, it's not the first zoonotic disease that we face, and I'm sure you already know how to deal with those things hygienically. But definitely the main thing we're going to need to focus on is reducing human-to-human transmission, which is the main issue at the minute. So having a better understanding of how things or the current situation is, knowing that which species can actually show clinical signs is relevant. But as we already mentioned, the first advice to anybody who is sick is to avoid contact with their pets. They should minimize contact with pets, in particular with ferrets and cats, I would say. But ferrets and other mustelids, we already know that they're susceptible to SARS-CoV-1, as well as to other viruses like human flu. So, that advice is not just applicable to the current situation, but generally speaking, whenever anybody has sort of upper respiratory signs or the flu or cold signs or similar, should really avoid contact with ferrets, generally speaking, and trying to minimize handling. The most recent event, actually, that has been reported related to mustelids, it's not truly been properly reported. There is no official report from the OIE yet. The World Organization for the Animal Health website hasn't really published anything yet. So, but I believe there were some animals that were showing clinical signs, and that affected a couple of farms in the Netherlands of European minks. So we don't truly understand it yet. Okay, but it's something to keep in mind. Obviously those will be the result as human shedding into the farm. Probably some people working in there. So it's important, obviously, whenever we're dealing with a ferret through this situation. We were going to talk about telemedicine a little bit later, but obviously minimize the exposure, minimize the time both the client hangs around or the patient isn't there. Get a good clinical history before he comes in, and even if ferret is showing clinical signs at all, obviously use the adequate levels of PPE. Something I would like to point at this stage, that as much as I would use PPE when needed, I do have a strong inclination to either use it properly or not to use gloves and masks. I think, people that I've seen many places where people just wear gloves all the time and do not change between patients or after touching different items or different, contaminated areas. And I think that's a lot more likely to spread germs, not just the coronavirus, but in general, cross contamination than if you actually wash your hands regularly, which is the more likely to be effective on stopping that. So those are the last figures from the Johns Hopkins University website, with over 3 million cases and just a handful of cases in pets or other captive animals. I think it's easy to realize, the real significance of those cases. And we need to keep in mind that the estimation says that we may only know of about 10 to 20% of the cases, because there is a great deal of asymptomatic infections in humans. And as I said, there's only a handful of cases that we've seen. A cat in Belgium, a few big cats in the Bronx Zoo, and so on. So that's probably that probably helps us to put things in perspective and realize that the main thing is as we said already, human to human transmission.
I do honestly feel that Hong Kong has probably got through this outbreak relatively well, with just over 1,000 confirmed cases and only 4 deaths. I'm not sure how accurate these figures are because I know it's difficult to collect this data, but even so, these numbers are low when compared to the rest of the world, especially considering we share a border with China. We're so densely populated, and also we had very little time to prepare for this situation. Now, as far as I'm aware, no veterinary hospital had to close down in Hong Kong, although us personally, we did have a small dip in patient numbers in January from clients understandably less keen to leave their houses, but since then we've been just as busy. Other industries had taken a bit more of a hit, like the entertainment and the restaurant sectors. I think the community here should be given a lot of credit for that, or for these low figures. This can probably be down to a number of intrinsic factors. For example, previous experience of an outbreak, the SARS of 2002. I was at college and it didn't really impact my life much, whereas I speak to friends and colleagues over here in Hong Kong and they remember how bad it was, and the people here have learned from that experience. Therefore, residents in Hong Kong, I would imagine, are that much more cautious and more strict with use of masks, hand sanitizers, and reducing their exposure to other people early on in the outbreak. I also think it's more of a common behaviour to wear face masks over here. I used to think it to be more of a prevention of catching diseases from other people or colds from other people, which it is, but also it's a respectful behaviour to help reduce chance of spreading a respiratory infection to others. From the start of the outbreak, local residents have always worn the face masks in public places, and would get strange looks and definitely some distancing if we didn't actually wear them ourselves. Although there is much debate on the effectiveness of face masks, with limitations including the common surgical masks are not airtight, so virus particles can get around the face mask into your respiratory tract. Virus particles are obviously very, very small, so can penetrate through the actual face mask material, and they also leave the eyes exposed to oncoming pathogens as well. Having said this, there have been publications such as this one from the Journal of Chinese Medicine Association and the second one here from Nature Medicine. They display here that support respiratory droplets being the main source of transmission, and surgical masks can reduce the detection of coronavirus RNA in these respiratory droplets. So in my mind, even though the evidence isn't concrete here, it doesn't do any harm to wear them, it's just a little inconvenient. So I do wear my face mask in and out of work. As shown here, to help reduce the risk of client to staff spread of infection, when speaking to clients, we all wear our surgical masks. And mostly when just staff are present, we generally use our masks too. Now most of us just use surgical masks, but you can go full Robocop like Dr. Peter here, who wears his mask and his visor to protect his eyes too. It's only him that does this. Our protocol to help out with client to staff risk starts downstairs in reception. All clients are temperature checked when entering our hospital using an infrared thermometer on the forehead. Again, how accurate is this? It's debatable, but it's just an extra barrier that we use. I do feel limiting the number of owners in the room for a consultation, however, is very useful, and also a number of clients visiting their pets in hospital is important too. Usually the whole family comes in and you can have 3 or 4 members there within a small room. Obviously high numbers of people entering the building increases the chance of being exposed to a COVID-19 positive person, and also the rooms in Hong Kong are quite small, so social distancing can become a bit of a problem when there's too many bodies in the room itself. It is recommended to be at least 6 feet away, which sometimes can be practically difficult. Regular cleaning is obviously essential. We actually have cleaners all day, every day, cleaning the hospital, even before the COVID-19 outbreak. We also now concentrate on disinfecting high-risk areas such as reception, so we're talking door handles, chairs where clients sit, etc. Also basic tools such as keyboard covers, which are easier to disinfect, can be used for computers. And those of you that know me, I literally use gloves every time I touch an animal, and I feel this can help reduce exposure to viral particles, as aerosol droplets can remain on your patient's fur, scales or feathers. And it's not just our clients that have to be temperature checked. We sign in, take and record our temperatures daily too. Luckily none of our staff have been sick with COVID-19, but if anyone was suspected, they'll be sent to be tested immediately. If friends or family were suspected, then that staff member would have to stay at home until the suspect was confirmed COVID negative. Anyone returning from abroad or from holiday would have to self-isolate for 2 weeks according to Hong Kong regulations. Now we don't actually perform house visits, so I can't really comment here, but obviously it'll be a good idea to limit this as you're increasing your risks when entering someone else's domain. So this is where telemedicine may come into play, and you may sort of help develop that in your practice.
So in regards to telemedicine, I think there's many options available, and I think the general public is already on board with this. It's been already a few weeks, and I think a lot of people was already using things like WhatsApp, Skype, or FaceTime, and similar. But you will be surprised how many just average members of the public are already familiar with Zoom, WebEx, GoToMeeting, or the Adobe Meeting service. You know, there is a lot of people who is already been using those through this quarantine period. So first advice I would say is try to do as much as you can remotely. You know, you do not need to speak with a client face to face to get a full history. And actually clients, you know, can get you a significant amount of physical data from the patient prior to coming in. So that could help you to triage those patients and actually decide whether they actually need to be seen or not. A few tips when it comes to telemedicine or remote medicine. Very important to always try to remain professional, you know, choose the right uniform. You know, you're still working, you're still offering a professional service, and you need to transmit that message to your client as well. Choose the right location. Make sure you don't have bright lights behind you. Make sure it's a quiet room where you're not going to have any distractions. You're not going to get interrupted. There's not going to be abnormal, unexpected loud noises affecting you. book yourself time, and that's extremely important. Give yourself time and book things properly. As I said, we need to remain professional. Obviously, introduce yourself if the clients don't know you, but also introduce anybody who is going to be in the room if you do need to. If there's any colleagues around or any members of the family for any reason, and perhaps ask to not just the person who is directly speaking with you, but everybody who is going to be also on that room to introduce themselves. That just makes things a bit more clear. And explain the process. If you're going to be taking notes, if your eyes are going to go away from the screen, explain that to the client so they know in advance what's going to happen. They're not going to judge you or think anything abnormal. Actually, most clients, if you tell them, I'm sorry if I'm not looking at the screen the whole time, I'm maybe typing or taking notes, I'm sure they will understand. Make open questions and let the client talk and say what they need to say. That's not different from any other consult. Obviously, we may be losing some of those non-verbal communication sort of signals that we all have or do when we talk. But let them talk, let them explain what their concerns are, take them seriously and listen to them, and obviously then try to guide them a little bit, but not excessively. You don't want to give them clues or point towards what you think the problem may be. Obviously, at the end, try to summarize what the key things are, and it's important to finish your appointment or your consult making a plan that you're both happy with. Not just you but the client, and make sure everybody's happy with how things have gone. And it's always good to have feedback, at least to begin with, to see if you actually have met their expectations. And I think that's applicable now, but it will be applicable to whenever there is changes in the way we consult, and the services we're offering change slightly.
I don't treat any cats or dogs myself anymore, and we don't see too many primates either. But as Dan covered earlier, mustelids are a family of exotic animals that we do see in practice. I did used to see far more in the UK, but I do still see ferrets and the occasional mongoose. We have small animal vets that work in our hospital over here, so we don't want to risk the transfer of COVID-19 to their patients or from their patients to ours. So I do try and impose some safety measures here for the benefit of these patients. I think the main point here would be to distance the potential at-risk species. So if any are showing clinical signs or clinical respiratory symptoms, then you may want to think about isolation here. I like to minimise their time in hospital, so I would go ahead and run my diagnostics and perform my surgical procedures, and the owners would either wait in reception, go for a walk or a coffee or whatever. When I'm happy the patient is ready to be discharged, they can come and collect as soon as possible to minimise potential exposure to our other inpatients. Also, basic hygiene measures should be practiced, so we're talking disinfecting areas that they have been, the appropriate use of gloves, and frequent hand washing as well. Now, they do love anything that's cute and fluffy over here, so we do see a lot of rabbits and a lot of hamsters, and I am aware there is currently a report being written describing the pathogenesis in lagomorphs, so watch out for that because that will be released soon. And hamsters are also being studied as they seem to show a remarkable rate of recovery from the virus when they are artificially infected. The area of interest here being the angiotensin converting enzyme 2 receptor, as there is a high similarity between this protein in hamsters and those in humans, or that one in humans. And this has a high binding affinity for the spike receptor that Dan mentioned in his introduction slide. I also just want to re-emphasise Dan's comments earlier that on the grand scheme of things, the transfer between domestic species is minimal, and our main concerns should be human spread. But being responsible exotic vets, we should be using our sensible judgment and protocols to reduce the unnecessary exposure to other pets. There is currently no evidence that supports domestic species being able to spread COVID-19 infections to humans, but again, more studies need to be carried out. So the advice here would be to limit exposure to pets if they are showing respiratory clinical signs. I should have taken a photo for you because on my way back today, I saw a local walking down the road with both her and her dog wearing a surgical mask, so that's always an option you can implement too. However, if humans have the virus, there have been those rare reports of passing them on to animals, so cats and ferrets seem to be the most susceptible. So standard hygiene measures should always be carried out, washing hands and disinfected workspaces between patients. Probably our biggest challenge was stock, to be honest. With China being such a major producer for our stock, we were a little bit worried about the start of the outbreak when China's workforce ceased. I think we was most worried about running out of surgical masks and surgical drapes and gowns, but it was quite sensible from the start. Quite sensible the use of a surgical mask from the start of the outbreak. And in terms of drapes and gowns, we do have single use, but we also have the reusable ones as well, so we could just autoclave those. Also, we're a little bit worried about alcohol that is used for surgery and sampling prep. Again, we were just a little bit more reserved in our use. We have hand dispensers or alcohol dispensers for our hands throughout our clinic, and we made use of those, but not like 10 pumps on our hands, maybe 1 or 2, again, just to sort of be a bit more sensible. Our company also equipped us with our own hand sanitizer for home use and the little portable ones that you can carry around at all times. We seem to have an endless supply of Hibby Scrub, so that can be a good alternative for regular hand washing. We do import a lot of our medications for our pharmacy, and this still is a little bit tricky, and we don't currently have the choice of antibiotics that we would like. For example, I'm a huge marbafloxacin fan for my reptiles, and we have none in stock. First, we ran out of the injectable, so I started using a compounded tablet preparation, and now we've run out of that as well. I'm sure you're obviously all using culture and sensitivity testing as much as possible, and I do feel like this is especially important at this time. We may have to use antibiotics that have some potential unwanted side effects. For example, in reptiles, I've used a little bit of amikacin and gentamicin when based on sensitivity, purely because I had no other antibiotic at my disposal that was effective against that bacterial infection. Now, obviously, risks and limitations should be discussed with owners, and hydration and kidney function should be assessed. So you're talking your PCV total protein and your uric acid if you're talking reptiles. You may need to be a little bit creative with your anaesthesia and analgesia if you run out of certain medications. Luckily, most of our exotic patients are fairly small, except we see a lot of sulcatas, our dabra tortoises and leopard tortoises. And for those of you that work in zoos too, you may need to be sort of using larger volumes, but generally speaking, most of our exotic patients are small, so require smaller volumes of these medications.
And just before we finish, I just wanted to recommend you a few websites that I think will be good to keep an eye on, to be updated on this. The first one is the IOE, the World Animal Health Organization. And most of the notifiable diseases and diseases that are relevant will be there. And you will get notifications. They're completely for free. You can register. So whenever is actually a confirmed case, you will get a notification, and that applies to whichever disease you think are relevant. I, for example, been following avian influenza for a number of years, as well as other notifiable avian diseases. But you will get notifiable diseases on all of them if you wish to. The World Small Animal Veterinary Association, again, has very useful guidelines. So you can have a look in there, as well as the American Veterinary Medical Association websites. They're both very useful. The World Health Organization also has advice for the general public on how to use masks and when to use masks and social distancing and all those things that the different governments across the world have been implementing. Last, the BioOne has opened a library of coronavirus-related articles which are free and accessible for everybody. So I hope you find that useful.
So I just wanted to finish up by saying thank you for your attention of this webinar, and I hope you learned something, whether it's just being a little bit more aware of the nature of COVID-19, its origins and its spread, or from my personal experience of hopefully getting through the worst of the outbreak over here in Hong Kong. If you have any questions or would like to know any further information on this topic, then feel free to contact either one of us.